Hi there, my name's Ross and I'm a Specialty Registrar in Dental Public Health and I work in the northwest of England. So a question I often get asked by dentists and non-dentists is, you work in Dental Public Health, what exactly is that? Well, if you Google it, you'll find a definition which is derived from Gostin, which will talk about how is the science and art of safeguarding and improving population oral health, and it'll talk about organised societal efforts. And whilst that's what we do, it doesn't give a practical insight into what dental public health truly is. So hopefully I can give you a little bit of a flavour of what it means to me. Now, dental public health is one of the 13 dental specialties. However, it's unique in the way that it's a dry-fingered specialty, and that is that I don't treat individual patients and I don't perform treatment on individuals, but rather within dental public health we view groups of individuals as our patients, and our treatment is trying to implement interventions which will improve the oral health of a large group of individuals. Now, if we consider this broadly, we can do this in three ways. The first might be looking at how we can implement change within communities, and this could be in the form of oral health improvement projects like toothbrushing schemes in a school, or we might look at ways that we can work with wider health and social care providers and local politicians to fluoridate a water supply. And what the implications of this might be. So looking at the oral health of the population and finding a way to make it better in that way. We can also consider the oral health of our population and try and develop new dental care services. So an example of this might be implementing a Tier 2 oral surgery service if the waiting list for oral surgery in the local secondary care service is completely saturated. So this would be utilising primary care estate and primary care providers who have reached a certain level of competence to provide slightly more complex treatment than a GDP might normally provide. So we look at ways of developing a service such as this and making sure that there's appropriate quality assurance in place, and work with NHS commissioners to try and develop something which actually results in a better outcome for patients, because they're not waiting as long, and they also might be being seen at a place which is more geographically convenient for them than going to the local hospital. We can also look at improving secondary care centres themselves, so looking at patient pathways into hospitals, how patients are managed within hospitals, and improving patient care in this respect. We also try and look after our patients and providers by making sure that the environments that they are treated in are safe. So if we consider COVID-19, Dental Public Health has been very involved in the delivery and the execution of the standard operating procedures, or SOPs, within primary dental care, and this has made sure that there's been a reduced amount of spread of this infectious agent within dental practice. What I would say is that dental public health is a very, very exciting specialty to be involved in if you like the sound of improving population oral health.